Good to see you. Yeah.
Welcome
back.
Yeah, thank you.
Talk about some interesting things today. I find that worked really well for you. Any questions? Okay, let's get started. You know about Mary's low back pain. Today we're going to go over some of the exercises to strengthen her core muscles as well as stretch her hamstrings. The combination will relieve the major cause of her lower back pain.
Well, I told you last time when we were looking at the x-rays that Dr. Troeger was explaining to me how low back pain is increased by, stress and pressure. That's why the medical doctor told me to come here.
Well, lots of people take painkillers. Do they really work?
It's certainly true that muscle relaxants and painkillers can make you feel more comfortable in the short term, but when the joints are inflamed and those nerve fibers are irritated, those drugs just don't seem to help very much. The problem is the joints aren't functioning well because they're under a lot of stress from wear and tear and irritation. The longer it goes on, the harder it is to fix. The other problem is weak muscles.
Well, Mary's in great shape and she is not a competitive athlete.
Bob, you have to remember that little things like falls and accidents and other stresses to your back, like carrying kids, cleaning the house, have a cumulative effect. Over time, they can come back to cause real problems.
I think I may have some of those problems too. Well, I've got tight hamstrings, that's for sure.
We both do.
Well, Mary, we're going to use a little bit of a different technique today to stretch your hamstrings, so it'll be easier for you to get a lot of stretch in a hurry.
Well, what's different about it?
Well, in most stretches, we utilize what we call a static stretch. That means you put your leg up on something and you lean forward. You might have done that before. When you do that, it uses receptors that are located at both ends of the muscle. But they're very slow to respond, and it takes anywhere from 20 to 30 seconds for that muscle to begin to stretch. So it's not that it's a bad stretch, it's just that no one takes 30 or 40 seconds to stretch a muscle. So therefore, they really don't get a good stretch. With this one, we do it very quickly, and as a result, we're using a different mechanism. It's a feedback mechanism where this muscle actually tells this muscle to relax. So you'll see what happens.
Okay.
Now in your case, we get up there, it starts to get pretty tight. So we're going to start right here and we're going to go up from that point. Okay? Now what I want you to do is to tighten this muscle up very tightly so that it locks the knee in extension, and then push against my shoulder as hard as you can without feeling any pain in your back. Okay? Go ahead and push. And that's it. Now hold that and keep this very tight. We're going to hold that for about 5 seconds. That's good. That's good. Now let it relax. And as you relax, we're going to bring it up a little higher. Okay? You're going to contract that again. Lock the knee. Keep it very tight. Okay? Push against my shoulder as hard as you can. There you go, as long as you don't feel any pain in your back. All right? Remember to keep that very tight. This is the hard part about this one, is doing both at the same time. Okay? Okay, let it relax. There we go.
Wow.
Yeah, we're going to do that again. Tighten that up real tight. Lock the knee and push real hard. As hard as you can. Keep this real tight. Sometimes I'll have my patients put their finger right in that muscle so they make sure that they can feel it tight. Okay? That's good. Let it relax. We're going to do one more. There you go. So you tighten that up again. Ready? Push real tight. Push into my shoulder. That's excellent. Hold it. A little longer. Hold it. Feel it tight. And relax. There you go. We do a little stretch. Now we're done.
Wow, I feel looser already.
That works pretty well, doesn't it? That's good. Okay. So you did very well with that. Now we're going to move on to the first abdominal exercise. Okay. A lot of people think that their abdominals are in good shape, but we remember that Mary has problems with some muscle imbalance in her lower back, and that's what's creating part of the joint irritation and the pain that you feel. So this exercise is really designed to isolate just those abdominal muscles, so that you're not using anything but those. So this may be a little more difficult than it looks. Okay? I'm going to have you bend your knees. There you go. Hold those right there. And I like to have your fingers right in your stomach muscles so you can feel what's going on. All right? Now what I want you to do is a simple pelvic tilt. So tighten those muscles. Rotate your pelvis that way so you feel your back push down against the floor. Okay? You feel that?
Yeah.
Okay. Now, what you've noticed is you've tightened your butt and your legs, okay, to help you get into that position. Did you feel that?
Yeah, I can't believe how difficult it is.
Okay.
I feel myself pushing my back down, but my stomach is so weak.
Exactly. Because when we do these exercises, we oftentimes utilize other muscles. Now, in your case, that muscle imbalance is the problem because our abdominals are relatively weak. So this one, we're going to focus just on those, and this is how we're going to do it. I want you to stick your fingers right there. Tighten that muscle, do the pelvic tilt. Hold that real tight. And I want you to slowly lift your head. And as you lift it, you'll feel that muscle tighten up. Can you feel that?
Yeah.
Now, when you feel that, you tighten that as hard as you can possibly make it.
Okay.
Okay, you hold that for 2 seconds. and you let it relax, let your head relax, let this drop back, take a little breath. We're going to do another one. Elbow tilt, stick your fingers, lift your head, hold it real tight, tight as you can, 2 seconds worth. Let your head drop back, let it relax, do it again. Tighten it up. There you go. Hold it as tight as you can. Gotta feel it working, okay?
Oh, it is.
All right, good. Let it relax. Okay, so that's the exercise. That really isolates that abdominal. You should feel like you've been making it work. You feel that?
Oh, yeah.
Okay.
Wow,
excellent.
this is great. I've never seen anything like this before.
Well, this is different. This is very unlike the usual kind of sit-up that you would do in the gym or somewhere else. And as a result, with this, we isolate the muscle that we want to get to. We can really get that balance back for you. Okay?
Great.
All right. Any questions?
These exercises are great. So do I need to do them every day?
Yes, I want you to use at least once a day. Now, you're only going to do 8 to 12 repetitions, so it's not like it's going to take 30 minutes. You don't have to do 100 of them, okay? It's a short time, but the key is to do them consistently. I mean, these are muscles that support you all day, every day, so we want to work them consistently. At least once a day. If you can do it 2 times a day, it's twice as good. 3 times a day is 3 times better, right?
Okay.
And it'll only take you probably a minute, literally a minute to a minute and a half to do them, so you should easily be able to get them in. Okay?
All right.
Now, this is just the beginning. This is the first exercise in the group. So after you get this mastered in a week or 2, then we'll add the second one, and we'll go from there.
All right.